Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Welcome back to Aging in Place Strategies and Answers podcast. If you are a new listener, then please check out my previous podcasts about urinary incontinence. I have done a segment on female urinary incontinence and pelvic health. I have had a physical therapist interview, and this physical therapist specializes in urinary incontinence, male, female, as well as pelvic health. And today I'm going to be focused on male urinary frequency and incontinence. So I'm glad that you have joined me today because this is something that we just don't talk about to a lot of people in our personal circles or at work. And sometimes we don't even mention it to our physicians who could really be our best friend. So if you know someone that is experiencing male urinary frequency and possibly dealing with incontinence, I encourage you to listen and then pass along the links to this podcast. On Aging in Place Strategies and Answers, I provide meaningful education, resources, and tips that can really help you live your best life at any age. So thank you for joining me. Now, before we get started, let's define some terms. It's always important for us to know what we're talking about. So, what kinds of incontinence will we be talking about today? Stress incontinence is the leakage of urine during activities because of increased abdominal pressure, such as coughing, sneezing, laughing, or physical exercise. Urge incontinence is this sudden, intense urge to urinate that cannot be controlled. Nocturia is when people wake frequently at night to urinate. Frequency is that feeling like you have to go to the bathroom, but you just went to the bathroom, or you didn't, went to the bathroom 20 minutes ago, but now you feel like you have to go again. So that is frequency. And then it is possible that people can suffer from a combination of stress and urge incontinence. So you may also suffer from urge or frequency. Those two can go hand in hand too. So now that we know what we're talking about, and you can kind of identify in your mind what we're talking about, be aware that Total bladder incontinence would be your inability to control any of that function at all. And that is a whole another conversation that you need to be having with your medical professionals. And it does happen, and there are reasons why. So let's talk about what can happen to produce some of these symptoms, specifically in men. Well, the number one problem can be the prostate, which men have, but when it is enlarged, or if there is cancer, or you have experienced prostate radiation treatments, or even a prostatectomy, this could lead to some of the kinds of incontinence that I just mentioned. Not to worry. A simple blood test that your physician can send you for will detect your PSA numbers and give your physician a good idea of next steps. So there is help out there if you don't know if you're suffering from an enlarged prostate or might even have prostate cancer. There can also be neurological conditions that can cause a form of incontinence, and this would be a stroke, maybe even MS, Parkinson's disease. All of these can affect bladder control, and those are neurological conditions. And then bladder muscles can get weak over time, and then they are less effective, and they are not perhaps allowing your bladder to empty completely. So weak bladder muscles. Then there is another situation that is temporary, and it is called a urinary tract infection. And while it is temporary, it can cause an incontinence due to the inflammation and irritation that it produces. But did you know that there are also medications that could contribute to urge or frequency incontinence? And it's important then, because you don't know, and I didn't know, it's important for you then to have your doctor review your medication list, because some medications that are used to treat depression, high blood pressure, allergies, plus any prescribed diuretic drugs or alpha blockers can really be part of the situation if you are experiencing any form of incontinence. And then there are also lifestyle factors that can affect this in what you're dealing with. And those are called lifestyle factors. Smoking, excess body weight can put extra pressure on the bladder as well as its supporting muscles, which can cause the risk of leaking and incontinence. And also taking a little survey, a personal survey on the kind of beverages that you are taking in, and could they be a contributing cause. Sometimes sodas, artificial sweeteners, caffeine, alcohol, bubble water can also be a contributing factor when you have this urge because they bother your bladder. So that list is pretty complete, and it gives us something to think about if this is something that we might be suffering from. Now, a word from our sponsor.
At Family Partners Home, we help residents maintain dignity while promoting well-being. Residents receive 24/7 supervision and care in a home-like setting in assisted living homes that are located in residential neighborhoods. Each home is a single-family home designed and built specifically for those with dementia. For more information about Family Partners Home, 314-686-4468, online at familypartnershome.com. It feels like home. It is a home.
Let's return to the podcast and continue our discussion on male incontinence. many times when symptoms occur or we get a new diagnosis or there's a change in our health, we all feel anxious and sort of lost and wondering where are we going to get this information. And if you don't proceed in a forward direction to get the information, sometimes these conditions can cause you to withdraw from regular activities, from social connections that you have. And this is why this podcast and knowledge can be so valuable to you. Because when you have knowledge and you learn some basic medical terms, you know what the symptoms are that you're experiencing because we talked about those items. You know that your lifestyle could be a contributing factor. Plus, there are websites that can offer support and education and potentially products. This is very helpful and gives you a direction and helps you to know that you are not alone in this struggle. Another thing that knowledge will help you with is to know who to consult. Who would you go to talk to about your condition? Are there support groups out there? And that is what knowledge can do for you. It takes the fear out and it pushes you in the direction to get the problem solved or the situation resolved. And so let's answer this question today while we're together. How does urinary frequency, nocturia, or incontinence impact quality of life? Well, remember that nocturia describes someone who awakens frequently at night, and this condition really can affect your sleep pattern. We know that those with nocturia who are getting up frequently at night have reduced energy. They feel more tired and lethargic. They feel emotionally out of sorts, and they usually do not stick to their regularly scheduled activities because it wears someone out. Okay, so this is very important. The other factor is that incontinence is very personal. And it is a dignity factor. We feel embarrassed by this. So whether you're man, woman, child, it doesn't matter. The folks who experience this kind of diagnosis tend to withdraw from regular activities, from things that bring them joy. Maybe it's physical activities, maybe it's group activity, and then start to leave the house less frequently because, of course, why? Because we're all afraid of what could happen when we leave and we're not prepared. Okay? So men, if you feel like you're all alone in the struggle with urge and frequency and incontinence, I am here to tell you that these are the facts. And we know that 1 in 10 men suffer from some form of these urinary issues. Stress incontinence can be more common in younger men. Urge incontinence is more common in older men. And mixed incontinence becomes more common with age. But don't let your age fool you. And I'm going to give you some additional numbers that are going to help you understand why I just said that. We shouldn't expect to have incontinence in our lifestyle as we age. That is not an expectation, okay? So here's the facts. From 15 to 64 years of age, the number of men suffering from incontinence is 15%. Okay, so you wouldn't expect that number to be that high. Now, for those 65 and older, those numbers jump to 30%. And if you're over 80, then those numbers can be as high as 50%. But if age was the main factor for incontinence, the numbers would be 100%. So please don't settle for bad information. get answers, get help, talk to somebody, and go to some of the websites that I'm going to give you in the podcast so that you can get some really great information. If you're a regular listener, you will know that I had Dr. Brooke Kalasyak. She is a physical therapist who specializes in pelvic health and incontinence in both men and women on one of my podcasts. In fact, I have a YouTube of that same podcast if you go to my Aging in Place Strategies and Answers YouTube channel. Anyway, she was one of my guests, and during our time together, she said, although we see more commercials portraying that image that as you age, you'll be wearing male Depends, she said that is not a valid assumption, and we need to kick that thinking to the curb. She said that through her practice of specializing in pelvic health and incontinence, she is able to help her patients regain quality of life and resume their normal activities. So don't let misinformation get in the way of seeking help. Many times, as I mentioned, the medications, the lifestyle factors, also that you might be going through a temporary issue with incontinence, but it is not always that you're going to get scheduled for surgery, because clearly there are doctors who specialize in physical therapy for incontinence issues. So where can you go to get help? Well, why don't you start with your primary doctor? Mention the symptoms that you're having. Have them review your medication list just to make sure there's nothing on there that is promoting this kind of incontinence. And if there is something on that list, do you need to still take it, or can that medication be taken at a different time of day so that it doesn't interfere with your normal activities? Maybe you're taking a diuretic because of a heart issue, but you want to go out and meet somebody for lunch. Maybe you have a golf game, or there might be another activity or group that you take part in. Surely that would be a good conversation to begin with your primary care doctor. And then, of course, for men, when we know that the prostate as you age can get larger, insist on a PSA test. They are not required anymore, and especially for men over 70. So you may really have to talk your doctor into it, but it may also shed some light on whether or not this could be a factor in what you're experiencing. Either way, you're going to get an answer, and answers are good. You can also ask for a specialist consult. Maybe you need to be seen by a urologist, or maybe you should be being seen by a physical therapist that can address your particular needs. And then, of course, I promised a list of organizations that can help you so that you are not alone. One of them is mensliberty.com. Another organization is National Association for Continence.org. And then another one that I found that could be very helpful is FixContinenceCare.com. And I will put those in the show notes so that you will be able to go to those organizations and do some preliminary fact finding so that you are armed with good information. You will probably also be able to connect with others, such as that either the professionals or there's a support group that can help you be able to get even better information from someone who's been there and done that. So if you're going to Google, and so many of us are, then Google the right thing and don't make yourself so scared that you won't then make an appointment to go to your doctor. when I spoke about female incontinence and also the items that were available to women so that if they were concerned about a urinary incontinence episode while they were out, then certainly there are many, many products, guards and pads and Depends that can help so that you can continue your normal life. Working in healthcare for the number of years that I have, and seeing many men who, through one reason or another, are now needing a catheter in order to eliminate fluids from their bladder. All these things exist. Not to say that you will need that, but we have had clients who have had male catheters who switch from a great big bag that might be used at night to a daytime bag. It's more discreet. You have the ability to manage it so that nobody can see it. And it certainly helps people to be able to get out and continue their lifestyle. Anytime we are looking at catheters, first of all, it's to help eliminate those fluids, those toxins from your body. But also, if you don't drink fluids and you don't go to the bathroom, overall, health-wise, you're going to be in the hospital. So things have to get resolved, but do get good information. So thank you for listening to me today about this difficult topic of conversation, but something that needed to be talked about. So I appreciate your time. But as always, I like to leave a caregiver tip at the end of every podcast. And my caregiver tip is for caregivers who are helping others and the person they're caring for, the care receiver, is experiencing incontinence. And so what I just said about catheters, that is a good conversation if there is total incontinence, no control, and you're trying to create the best health scenario you can for the person you're caring for. I would also encourage you caregivers to listen to my podcast about Easy Pants. And the developer was on my podcast. I also created a YouTube on my YouTube channel so that you can watch that, where she demonstrates the Easy Pants that help people be able to manage the incontinence themselves, because these pants are adapted for that sort of usage. So we've talked about catheters, we've talked about products, we've talked about adaptive clothing, and then it is important that when you're visiting with a primary care doctor or a specialist, that you also understand that physical therapy, someone who specializes in incontinence, can be very valuable to you. So on these websites that I connected you to during the podcast, the National Association for Continence.org will help you find somebody in your area. You're always welcome to reach out to Brooke Kalasiak from Legacy Therapy STL, because she also has a list of folks on her website as well. As always, I value the time you spend with me. Thank you for joining me today. Please remember that this podcast is intended as education and not advice. Don't forget to share this podcast with family, friends, or colleagues who want to learn how to age in place, but also share this with those who find themselves in crisis mode. Please go to my website, seniorsupportstrategies.com, for more information. When you subscribe, to Aging in Place Strategies and Answers, you gain access to premium content and professional tips on creating your own Aging in Place roadmap. As always, I value the time you spend with me.